Hello, and welcome to our Champion Series, Module 3, Personal Risk Assessments. This is provided by the IPAC Hub at the Thunder Bay District Health Unit. We hope at the end of this module, you'll have an understanding of the chain of transmission and what measures we can take as congregate living setting employees to break the links of the chain in order to stop transmission within our settings. You should also be able to identify routine practices, additional precautions, and know when and how to utilize them. You will also be able to describe the purpose, steps, and processes of performing a personal risk assessment, why it is important, and how this practice can help reduce the transmission of infectious diseases. So, PIDAC, Routine Practices and Additional Precautions Best Practice Document, is the most important resource when learning about the mechanisms of transmission of microorganisms. This is a document for healthcare facilities, but much of it can be applied to our congregate settings. The document also discusses various organisms that require personal protective equipment, additional environmental cleaning, isolation, or engineering controls. So, this document is a baseline information that should be followed in all settings unless any additional legislation is applied, such as a direction from the Ministry of Health. So, feel free to pause the slide and utilize this QR code to be linked to the document. It can be downloaded and saved for future reference. Just be mindful if you do download and save it that sometimes these documents can be updated. So you would want to check it occasionally or connect with us if you're unsure if there's a newer document out, a new version of it. So let's dive into it. We're going to talk a little bit about routine and additional precautions. So, the goal of these precautions is to reduce the risk of transmission of microorganisms in our settings through understanding the following concepts. So, number one would be understanding the chain of transmission and breaking its links. Number two is the concepts and application of routine practices, knowing why and when to utilize additional precautions. And the number three would be understanding the barriers and enablers that affect compliance with these practices. And then using that personal care risk assessment to guide our IPAC principles when interacting with our clients and our clients' environments. And then number five would be using and applying um, personal personal protective equipment correctly when indicated, so in order to protect yourself and the clients. So let's start with the number one, which is the chain of transmission. This model is used to explain how one, infectious agents are spread, and two, how infections can be prevented. Understanding this model can help break down specific steps that workers take to reduce the spread of infection at each link. An infection cannot develop and spread unless all six of these links are present and connected. Routine practices and additional precautions can help break those individual links and prevent the transmission of pathogens between our clients and our staff. So, how does transmission occur from the pathogen to the susceptible host? So, this can happen when one, an infectious agent is present. So, the chain of infection, there has to be a pathogen. This pathogen can be a bacteria, a virus, a fungi, or a parasite. So next, for an infection to occur, the pathogen needs a reservoir. So that means that's a place for it to live, grow, multiply. An example of a reservoir could be a person, it could be an animal, it could be food, it could be water, or it could be soil. Next, the infectious agent needs to exit the reservoir by a portal of exit. So this would be leaving that animal leaving the soil, leaving that person. So, some examples could be coughing, sneezing, vomiting, diarrhea. And then the agent needs to spread from one to another. So this could either be another person in the healthcare facility. So this is where we kind of talk about the modes of transmission, and we'll get into the contact, droplet, and airborne transmission. Next, once they leave and they found that mode to get to the next place, they need that portal of entry. So, a place where that can actually enter the person to start causing illness. So, this could be a person's mouth. So, if you're eating, drinking, putting your hands in your mouth, your mucous membranes. So, that would be rubbing your eyes, non extact skin. So, it could be a wound. Nasal pathogens. So, inhaling it through your nose. There's lots of different portals of entry. And then finally, that person who's been exposed needs to be susceptible. So anyone can be a susceptible host. However, infants and elderly and those who are immunocompromised can be more susceptible to infections. So, in a healthcare setting, a surgical patient or someone with burns or open wounds would be a far more susceptible host due to the fact that they don't have that non intact skin. So, again, these are the 6 links, and each of these links have to be present for an infection to develop. So, you need to have the pathogen, it needs to have a reservoir where it can live and thrive, then it needs a way to exit that reservoir, and then it needs to go from that exit to the next person through the mode of transmission. Once it at the person, it needs a place to enter it, and then that person needs to be susceptible to it.
So what happens when we break a link? By breaking any of the 6 links, you are breaking the chain and transmission cannot occur. Our goal through IPAC measures is to break one or more of the links, therefore breaking the chain of transmission. It may only take one broken link to stop transmission, but a layered approach is best practice, as infectious agents may change or adapt over time. If we only rely on one broken link, it increases the odds of transmission. If we break one or more links, it makes it more challenging for the infectious agent to overcome the obstacles. So let's look at each link in the chain and what breaking it could mean. Infectious agents. This link requires a viable pathogen to be present within the host. To break the chain of transmission, IPAC measures are focused on killing or removing the infectious agent at the source. Some examples of these measures include appropriately administering antibiotics, the manual removal of a parasite, or disinfecting the skin surface before a surgery are all examples of how to eliminate or reduce the infectious agent. We can eliminate the reservoir by using effective controls of the environment and environmental cleaning. For example, if we store food properly and treat contaminated water, infectious agents cannot grow there. Applying a disinfectant to a surface or a tool will also eliminate the ideal environment for the agent to survive outside of its host. Another way to break the chain of transmission is managing how infectious agents leave the body or other reservoirs through the portal of exit. We need to manage all blood, bodily fluids, excretions, and secretions which exit from the body in a way that helps reduce the risk of infection. For example, when we sneeze, if we cover our mouth and nose, we will reduce the amount of droplets from traveling through the air and landing on surfaces. Another example of eliminating a portal of exit would be to contain wound drainage with a clean and dry dressing and despoiled of soiled linen appropriately. The link that we can most easily control is the mode of transmission, which will prevent infectious agents from reaching the susceptible host. The single most important action you can take to prevent the transmission of infection is to perform hand hygiene. The proper use of personal protective equipment also helps to prevent infectious agents from traveling between person and the environment. Additional precautions document outlines what PPE and environmental cleaning practices to use for different pathogens. Controlling the portal of entry means keeping the infectious agent from entering a susceptible host. If we provide care with clean hands and use aseptic technique when caring for clients or interacting with their immediate environment, we can stop agents from entering a client who might be at risk for infection. And what about susceptible hosts? If a person is not susceptible to an infectious agent, he or she cannot get an infection. Immunity develops from receiving vaccines, or an individual can acquire short-term immunity from developing an infection. When a client, patient, or resident receives treatment, such as preoperative antibiotics, it reduces their risk of infection. When we are as healthy as we can be, we are less at risk of infection and we are more likely to fight them off. And now it's time for a concept check where we test your knowledge of what we have learned so far. So our question, transmission can occur if most of the links are complete in the chain of transmission. And this is a true or false question. So the answer to this is actually false. Transmission can only occur when all of the links are complete. By breaking one of the chains, you are able to stop transmission. Recall that IPAC measures strive to break more than one link to layer the approach. We have another question here. A pathogen that is coughed from its reservoir demonstrates the chain link blank, while the susceptible host that inhales the cough is the chain link blank. We have a bank of words at the bottom: infectious agent, reservoir, portal of entry, mode of transmission, susceptible host, and portal of exit. So here we have a pathogen that is coughed from its reservoir demonstrates the chain link portal of exit, while the susceptible host that inhales the cough demonstrates the chain link portal of entry.
Now we are going to take a more in-depth look at the Provincial Infectious Diseases Advisory Committee's Routine Practices and Additional Precautions document to further deepen our knowledge of IPAC practices. Remember, routine practices are based off the assumption that all individuals are infectious. They are baseline practices we should be using in our daily lives when interacting with clients. Additional precautions are what we put in place after a client is suspected or confirmed to have an active infection that they are at risk of transmitting. At the back of the document, there is a list of infections and what precautions need to be put in place. You can refer to this document anytime there is a new organism brought to your attention to determine what level of precautions your staff needs to take. Routine practices are based on the premise that all clients are potentially infectious, even when asymptomatic, and that the same safe standards of practice should be routinely used with all clients. These practices prevent exposure to blood, body fluids, secretions, excretions, mucous membranes, non-intact skin or soiled items, and prevents the spread of microorganisms. Routine practices include hand hygiene and routine use of PPE, but also extend to other elements such as PCRA, controls of the environment, and administrative controls. The consistent and appropriate use of routine practices by all staff members during all interactions with the client's immediate environment will lessen microbial transmission in the congregate setting and reduce the need for additional precautions to be implemented. Let's discuss specific elements of routine practice. Personal risk assessment, also known as PCRA, is a type of checklist to be performed by staff prior to interacting with the client or the client's immediate environment, such as their room. This typically occurs before performing a level of care or activity with them or cleaning their room or washroom. This assessment will determine how the staff member should protect themselves prior to the interaction based on the potential for exposure to infectious materials. We will discuss PCRA more in depth later on in our presentation. The next element is hand hygiene. A part of routine practices is ensuring to follow the 4 moments of hand hygiene before and after interacting with clients and their immediate environment. This was discussed in great detail in Module 2. Organizations are also required to develop appropriate policies and procedures in relation to hand hygiene to prevent the spread of infections based on routine practices. The next element is administrative controls. These include policies and procedures that staff are familiar with to prevent the spread of infectious diseases. These policies and procedures may include staff education to promote awareness of IPAC measures, respiratory etiquette for both staff and clients, and healthy workplace policies to allow staff to stay home when sick with a communicable illness to prevent further spread. Immunization programs for both staff and clients would be included under administrative controls. The fourth element of routine practices is control of the environment. This refers to the space the client is dedicated to, which, depending on the setting, could be a room and adjoining bathroom, or could be a whole home, or just a single cot within a shelter and shared bathroom. Things to consider in the control of the environment is appropriate placement and spacing of beds, location and number of bathroom facilities, cleaning of shared equipment in between each use, and client and engineering controls. These include elements such as well-maintained HVAC systems, the use of barrier screens, curtains and plexiglass in the care area, point-of-care sharps containers, and alcohol-based hand rub and accessible hand washing locations. The final element of routine practices is sufficient access to PPE. We have already gone through the steps to identify the level of PPE that is required, but it is important to ensure the PPE is appropriately stocked and easily accessible to staff where and when they need it. This would also include ensuring PPE expiration dates and that they are stored appropriately so they are not temperature damaged, tampered with, and protected from contamination. Routine practices are the IPAC standard practices that must be used routinely during all activities with all clients, patients, or residents to help prevent and control the spread of infectious agents in all healthcare settings. Visitors also are subject to routine practices. This can be addressed through facility signage and education from staff members. No matter what setting you work in, routine practices always apply. Additional precautions are used in addition to routine practices and do not replace them. Additional precautions are used in a few different situations. First, when a client is colonized or infected with certain microorganisms. Recall that colonized means that the microorganisms are present within the client, but not necessarily causing an active infection. The additional precautions interrupt the known or suspected modes of transmission. A good example of this is when a client is colonized with MRSA. Even though there is no active infection, the bacteria is still present within their body, and proper precautions must be taken to avoid spreading these microorganisms to others, where infection could occur. Second is when a client is symptomatic. For example, if a client has a fever, new cough or sneeze, or is experiencing acute vomiting or diarrhea. It is important to treat this client as if they are infectious, even if there is no lab confirmation of any infectious illness at present. Treat them as infectious until it can be ruled out. And lastly, is when a client has been exposed to an infectious agent but is not symptomatic or infected. So, example of this would be using MRSA again. A client who is sharing a bathroom with someone who is MRSA colonized will require their own contact precautions as well. So, let's review what additional precautions include. Additional precautions build off of routine practices. The additional precautions are based on the client's suspected or confirmed agent and the mode of transmission of this agent. Clients who are suspected or confirmed to have an infectious agent require signage to inform of the additional precautions, and the clients may also require specialized accommodations. A sign posted outside the client's room clearly states what type of isolation they require, typically based on the modes of transmission discussed. Some clients will require a private room or private toileting facilities. Recall that signage may be required for the contacts of clients. For example, those clients who may share a room, home, or bathroom with the infectious or symptomatic client. Additional precautions will dictate PPE requirements. If it's facial protection or respirators such as N95 are required. Appropriate signage for the agent will dictate the PPE required for staff and essential visitors. Appropriate education on using and handling the PPE and signage to prompt donning and doffing areas helps ensures that PPE is being handled and disposed of in a way that prevents transmission. Additional precautions also indicate if dedicated equipment or enhanced cleaning protocols for the client's environment is required. For example, if there has been significant transmission of an antimicrobial resistant organism in a hospital setting, IPAC may request that clients be given their own blood pressure cuffs or other frequently used communal items. Some organisms also require specialized environmental cleaning, such as C. diff. Module number 5 will discuss specific environmental cleaning practices more in depth. Limited transport includes clients being moved between facilities or in and out of their home for appointments, must be considered when a communicable disease is present or suspected, unless medically necessary. As well, depending on the type of facility or home, it is appropriate for the client to remain in their room and have their meal trays brought to them, rather than attending group meals in a common area for the duration that additional precautions are required. Other IPAC measures may be considered when transport is required or social interaction may occur. Lastly, communication. It is extremely important to have effective communication regarding what additional precautions the client requires. The communication must be clear and concise and provided within a timely manner to be the utmost effective. Communication needs to be provided efficiently for the staff. Any outside agencies that could also be providing support or care, visitors or other congregate uh, living settings, or healthcare partners in order to prevent further spread of infections. Remember that all six of these elements are required to be put in place for anyone who encounters that particular client and their immediate environment.
Specialized accommodations, signage, and PPE are all based on the infectious disease mode of transmission. The terminology for this level of precautions we may be more used to hearing is contact precautions, droplet precautions, and airborne precautions. On the slide, you'll see that the PPE requirements for each type of precaution is listed. It's important to keep in mind, however, that a client is not limited to one at a given time, as they can often be on a combination or mix of precautions as well. Such as with COVID, the initial minimal requirement was droplet and contact precautions. This combination of additional precautions becomes the minimal requirements, and any further precautions based on a point of care risk assessment could be further initiated, such as N95 use for any direct. Here is an example of signage for airborne precautions that is provided by Public Health Ontario for acute care facilities. You can see that the sign states that clients on airborne precautions are required to have their door closed at all times, any transport is to be limited, and all visitors and staff who enter the environment must wear a properly fitted N95 mask. One thing we particularly like about the PHO signage is that on the heading under precautions, it specifies in addition to routine practices. So, to remind you that these additional precautions do not replace our routine practices, such as performing a proper risk assessment and hand hygiene. Here we have PHO signage for contact precautions, which at minimum requires a gown, gloves, and dedicated equipment for the client's room, such as a blood pressure cuff or thermometer. The signage does not identify any additional environmental cleaning policies, but they are sometimes required for specific organisms such as C. difficile or VRE, which may require the facility to implement additional signage or a checklist system to notify any housekeeping or cleaning staff. Lastly, let's take a look at droplet precautions. This sign identifies for PPE requirements that a mask and eye protection must be worn if the staff member or visitor is within 2 meters or 6 feet of the client. If the client must leave the room, a medical mask must be worn during transport. As we stated earlier, you are not limited to one type of transmission or precaution. These precautions we see here are a combination of droplet and contact, which are likely very familiar because of the COVID-19 pandemic. These precautions require eye protection, a mask, a gown, gloves, and dedicated equipment. Again, for clients who need to leave their room, a mask is required to be worn. In the event that a client requires mixed precautions and you're unsure of what to follow, always go with the highest level of PPE required and the highest level of environmental cleaning. We have now reached our second concept check of Module 3, Point of Care Risk Assessment. For this question, please answer true or false. All clients should be treated as if they are infectious, and the same type of PPE can be used for interactions with them. Pause the module if you need more time. The answer is false. While all clients should be treated as if they are infectious using standard or routine precautions, it should never be assumed that the same PPE is required for all client interactions. A personal risk assessment or implementation of additional precautions, such as droplet, contact, or airborne, may indicate the need for specific types of PPE, and thus each client interaction will be different.
Breaking the links in the chain of transmission helps prevent the development of infection. But how do you protect yourself from infection? And what can your workplace do to help protect you and the healthcare environment in which you work? The answer is to perform a risk assessment. There are two types of risk assessments. One, an organizational risk assessment is done by your employer or facility to assess the needs for certain controls or safeguards. For example, engineering controls include safeguards built into the building structure itself, such as special ventilation or dedicated hand washing sinks. In addition, cleaning processes for the environment and equipment, physical barriers and linen, waste and dish or utensil management are included in this. An additional risk assessment needs to be done by the employer in each congregate setting. Administrative controls or safeguards introduced by the management of each setting to continue to make a workplace safe. such as having clear and current policies for cleaning and staff education and training. Provision of necessary personal protective equipment, or PPE, such as gloves, gowns, masks, and eye protection, is another important safety measure that must be provided by your employer. Once your employer identifies areas of risk related to infection prevention and control, interventions may be put into place to minimize those risks in order to protect you, your coworkers, your clients, all from getting an infection. A point of care risk assessment, as referred to in healthcare, or a personal care risk assessment, as we like to utilize for our congregate settings, is a thought process that each healthcare provider or staff member must engage in before each and every interaction with their client or their client's environment. This is done at the point of care and is necessary to help prevent the spread of infection. A risk assessment helps providers in choosing interventions which help prevent the spread of infectious agents. So, a personal risk assessment or point of care risk assessment can also be referred to as a PCRA. So, you must perform a PCRA, one, before any interaction with the client, and two, before any interaction with the client's environment. A risk assessment is necessary because other controls may be absent or do not completely eliminate the risk. To help learn about a personal risk assessment in the workplace, let's consider how risk assessments are done by each of us every day. For example, consider the decisions you make before crossing the street. Your mental checklist might include these questions. Is there a car coming? Is there a crosswalk? Do I have time to get across safely? What are the capabilities of the people with me? Are they young? Are they old? Are they slower than me? This is a risk assessment, and you may not even realize you are doing it because you have been trained to do it since you were young. Without this risk assessment, if you just walked right across the road without even doing any of it, you could put yourself at risk or other people at risk, such as those in vehicles or bikes. In congregate settings, you need to use risk assessment questions in the same way to help guide your actions as you work and to keep you and others safe. Just as with the mental checklist used when crossing the street, you will utilize a checklist for your point of care risk assessment. This PCRA assessment is ongoing throughout your workday, and the more you do it, the more comfortable with asking yourself the traditional PCRA questions you will be. You will form an automatic checklist that you will do and redo with each interaction with the client or their environment. So they have reduced the PCRA into three main questions you should focus on. You're going to ask yourself before each and every interaction with a client or environment. One, the task. What task are you about to do with the client? Are you helping with toileting? Are you sitting and helping them with a puzzle or game? Are you providing direct medical care, such as changing a dressing or doing a physical assessment? With this task, is there any exposure? My task is to assist with toileting. Will I have any exposure to bodily fluids? So let's look at some more questions that you may ask yourself when you're assessing the task at hand. Consider the task you're about to perform. Do you have the equipment needed to do this task? If the answer is no, gather those equipment supplies needed before doing the task. Will I be touching blood, bodily fluids, secretions, or any other potentially infectious material? If the answer is yes, wear gloves if the task involves any contact with these secretions or excretions. Consider additional PPE. Another question, will my face potentially be exposed to cough or spray of saliva or blood? If yes, wear facial protection. Will my clothing or skin potentially be exposed? Wear a gown if the task exposes your clothing or skin to blood or bodily fluids. How skilled am I at this task? Can I safely perform this task myself, or do I need assistance? Ensure you ask someone to assist you if necessary. The next question you need to ask yourself is the physical and cognitive status of the client. So you have determined the task. So that is maybe perhaps assisting the client with toileting. Now we look at the client specifically. Am I able to verbally direct them, or do I need to physically assist them with the task? What equipment will I require to assist them? This may create a new task and a new risk of exposure. The next step in your personal assessment is to ask yourself some questions about the client. So you're going to be assessing that cognitive and mental status. Again, are they able to follow directions? You may need to change how you're going to provide the care for the client depending on whether they can follow verbal cues. Are they cooperative? Remember to consider the extremes of age in your risk assessment because they may not be able to understand what you're trying to do. Are they agitated or resistant? You may need to change how you're going to provide the care for this client dependent on that. Think about the physical status. Are they coughing, sneezing, vomiting, or have a diarrhea? Do they have any behavioral tendencies such as coughing, handling stools, spitting? You may need to wear gloves and a gown if you're going to be touching any bodily fluids or excretions such as vomit or stool. Wear a gown if your clothing or arms may be soiled with blood or fluids or excretions. Wear facial protection if your face may be exposed to droplet. An example is a cough or a sneeze. If they are incontinent or do they have uncontrolled drainage, you may need to wear gloves and a gown to clean the contaminated environment. Then, as always, ensure you clean your hands. Thirdly, the last question is around the controls of the environment and the administrative controls that may be in place for your protection. Is there a grab bar for the client to assist themselves in toileting? Is there a sink that is accessible to them for hand washing? Is there a policy or procedure, such as a care plan, in place for this client that I must follow? Some other questions that you may be asking around the controls of the environment and administrative controls could be placed in by your employer. So ask yourself questions would be, are there facilities for cleaning my hands? Know where your facility's alcohol-based hand rub stations are and where your hand washing sinks are located. Are there policies and or any policies and procedures for me to follow? Know the infection control and prevention policies, procedures in your facility. Is a special environment necessary for this client to contain transmission? So assess the need and availability for the client, perhaps to be in a single room, to be segregated from others, or have single toileting facilities. A good way to remember a point of care risk assessment or a PCRA is TSE, the task, S, the status. So we're looking at that physical and cognitive status, and then E, the environment. So the controls of the environment. For the PCRA, if you can remember TSE, then those questions will follow from memory. Here's a summary of the last few slides into 7 common questions to ask yourself when doing a PCRA. What is my risk of exposure? What is my skill level for this task? What are the patient's symptoms? What actions do I need to take? What task am I doing? What is the environment where I'll be performing this task? And how cooperative is the patient? So these are a good 7 common ones to ask yourself every time. So Public Health Ontario also has 2 algorithms or flowcharts for assisting in point of care risk assessments that we'll go over both of them with you today. The first one here is from Appendix B of the Best Practices for Routine Practices and Additional Precautions document. So we have also included the link through the QR code here if you'd like to access this. It's an easily printable fact sheet that you can use as well. So the flow chart here is on the left-hand side of the screen. This is an individual assessment of each client's potential risk of transmission of microorganisms, and this must be made by all staff who come into contact with them. Based on that risk assessment and a risk assessment of the task, one may determine appropriate intervention and interaction strategies, such as hand hygiene, waste management, use of personal protective equipment, and placement. And this will help reduce the risk of transmission to and from the individual. The first flow outlines the risk assessment steps to be performed by the provider to determine the individual risk of transmission and the rationale for associated protective measures. We'll answer the 3 decisions you're making we reviewed earlier: the task at hand, their physical and cognitive status, and the controls of the environment and administrative controls. So let's break down this flow chart and look at each of these decisions here. So we're just going to circle here on the left-hand side, and then we've blown it up on the right-hand side so you can see it a little bit better here. So the decision number 1, it questions the task at hand. What is your purpose and what are my exposures to the client? Do I need protection for what I'm about to do because there is a risk of exposure to blood, bodily fluids, mucous membranes, non-attacked skin, or contaminated equipment? Will the task you are performing put you at risk of these exposures? If the answer is yes, the appropriate intervention would be to put on the appropriate PPE to protect yourself, the client, and the spread to others. Decision number 2. So you are stopping to think and assess the physical and cognitive status of the client. Do I need protection for what I'm about to do because the client has undiagnosed symptoms of infection? Are you responding as your client's wellness has changed and needs intervention? This may include doing a reassessment after you realize new signs or symptoms are coming from the client. You may have started your shift with no concerns, but maybe as the shift goes on, the client's condition worsens and there may be new symptoms or behaviors that require reassessment. In this situation, it is appropriate to remove yourself, reassess, and then you may be required to add additional PPE or initiate precautions on the client. And then decision number 3 addresses the controls of the environment and administrative controls in place for your protection. What are the organizational requirements for this client who has an identified infection? Examples would be signage requirements for individual clients on additional precautions or a unit of the facility on outbreak. Appendix B broke it down to 3 bigger picture questions: the task at hand, so what you are doing, physical and cognitive status of the client, any signs, symptoms, or behaviors, and E, the environmental and administrative controls in place. Are there protocols or directional signage in place? Okay, Public Health Ontario's other flowchart here. Again, we have a QR code for it. You can access it, but it's also on the right-hand side of the screen here. This one can be utilized for all clients, which outlines the specific PPE or controls that must be put in place based on the point of care risk assessment. So we're going to do the same thing. We're going to break it down. We just have the top half of it here, and then we'll go over the bottom half of it next. So prior to interacting with any clients, you're assessing the anticipated interaction following the logarithm. So with each step, you'll be able to determine what PPE you need for this interaction. So from you did the first one, maybe you need a little bit more, or you're just assessing just the task, you could use this one. So step-by-step flow. 1, will I be exposing myself to splash or spray of blood, excretions, or secretion? For this example, we will say yes. Number 2, will my hands be exposed to blood, secretions, excretions, or a contaminated item? We will say yes again, which prompts us to wear gloves and perform hand hygiene as our intervention. If no, that you will not be exposing yourself to any splashes or sprays, then follow down to the next question. Will I have contact with the client environment? And continue to follow the pathways based on your responses. We left off with the answer yes pointing to the next question. Will my face be exposed to a splash, spray, cough, or sneeze? If your answer is yes, the logarithm prompts you to add facial protection. The next section of the logarithm prompts you to ask yourself if your clothing will be exposed to any sprays, splashes, or items contaminated by bodily fluids. If your answer is yes, the logarithm prompts you to wear a gown as well. The last question, does the client have a known symptom of infection? If yes, you would refer to the additional precautions required for the known or suspected infectious agent. You can find this listed in the Appendix N of the Routine Practices and Additional Precautions document, or speak with your in-house infection control practitioner if you have access to one. Okay, now that we have all that information, we're going to do a concept check. So, a personal risk assessment requires you to ask yourself all of the following, except what is the cognitive and physical status of the client? Am I being audited? What time of day is it? What am I completing with the client? Are there any policies or procedures I need to follow? So, before answering this question, consider all that are true. Think of the T, the S, and the E, and find the one that doesn't fit. If you need another moment, you can pause the slide now. If not, we'll answer it on the next slide. So the one that is not true is B. Am I being audited and what time of day is it? These are not included in your risk assessment. The others go under the T, the S, or the E. The task at hand, the status of your client, or the environmental factors. So, hey, fantastic. Thank you for staying with us during all this material. We hope that you leave this module with an understanding of the chain of transmission and what measures we can take as professionals to break those links in order to stop transmission within our settings. We also hope you can identify routine practices and additional precautions and know when and how to utilize them. You'll also be able to describe the purpose, steps, and processes of performing a point of care or personal risk assessment, why it's important, and how this practice can help to reduce the risk of transmission. You have now reached the end of Module 3. Thank you for your participation. Module 4 will dive into PPE auditing and observations. Return to the IPAC Hub website to find the next module in this 5-part training. Thank you.